Bismillahirrahmanirrahim. Let's discuss the normal labor, so through which the pregnant woman and deliver her baby. Okay, so what are changes occurring during this phase? What is happening to the fetus? What is happening to mother? So we have to cover in this lecture. So with mean this is normal labor. There is no intervention. Mean there is no C-section. It's just a normal vaginal delivery. Okay, so what is happening? So what are our learning objective? First we define and then look at the what are contraction theories of the uterus. Okay, and Bishop's score, and we have to look at the strategies of labor and the management. Okay. Let's start with the definition of labor. Labor is the onset of the regular uterine contraction. Regular uterine contraction with progressive the cervix changes. What are changes? Progressive effacement and dilation. Effacement and dilation, and the descent of the presenting part of fetus. Okay, so the all the component of this definition are important. If you miss any component, so it's an incomplete definition of labor. So you have to mention the regular uterine contraction, and it should be with the progressive effacement and dilation of cervix. Means cervix changes should be occur, and there should be a descent of the presented part of fetus. So this is a complete definition of the normal labor. What are factor we are considering in the normal labor? So if they are not fulfilled, we have to do some intervention. So there are some other factors, there are some doctor factor, and there are some fetal factors. Number one is the spontaneous expulsion. So if it does not occur spontaneously, what intervention we do? It would induce the delivery. Okay, and through natural passage, mean birth canal, this is normal. Okay, so if it's not possible, what intervention option is? C-section. Okay, without complication of mother and fetus. If this is the with complication, we will not consider it a normal. It's considered the complicated delivery. Okay, so we have to do action for the complicated delivery. Okay. The fourth, the without interference. I mean there is no ductal interference except episiotomy. So episiotomy is considered in the normal labor. Okay. So other option are instrumental delivery and the forceps and ventouse. So these are the interventions. Okay, it should be within a reasonable time in 4 to 24 hours. If it's before that, so that intervention is known as a precipitated. If it's more than 24 hours, so it is known as a prolonged labor. Okay. So if you look at the fetus, so in the normal it's a one. What is intervention is a multiple fetal pregnancy, mean more than one. Okay, and the fetus should be alive. Okay, otherwise the intervention what can occur? It's the intrauterine fetal death. Okay, dead. Then mature fetus is considered between 36 to 42. Before 36, it is known as preterm, or if after the 42, it is considered the post-term. Okay, and with vertex presentation, the normal presentation is a vertex presentation. So what are other abnormal presentation? The shoulder, breech, burrow is where the presentation is occipito-posterior instead of the occipito-interior, which is normal. Okay, here the presentation is occipito-posterior. So these are the different normal labor criteria and the interventions. Okay. Let's see the definition and explain the definition. So first is the regular uterine contraction. So let's see what are theories for the uterine contraction. So number one is the fetal pituitary gland produce the fetal cortisol. Okay, so this increase in fetal cortisol decrease the progesterone. Okay, so that and the decrease in progesterone, increase in cortisol. So this will lead to increase the prostaglandin. So that prostaglandin increase the free calcium that cause the uterine contraction. Okay, so this increase the uterine contraction. So second thing, the placental ischemia that decreases the oxytocin, which actually destroying the oxytocin. Oxytocin is also increasing the prostaglandin. So if this enzyme is decreased, so mean oxytocin level will increase. So prostaglandin increase, uterine contraction increase. The next is the important changes in the mother is happening. So their oxytocin receptor are increasing in the cervix. Okay, so increase in the receptor, and also they increase the synthesis of the oxytocin. Both things causing the increasing the contraction, because the oxytocin itself increasing what prostaglandin. Okay, so that's why it causes the increase the uterine contraction. The next is the some neurological factor, especially alpha receptor nerve fibers. So they are playing a role in the contraction. So they initiate contraction in and around the uterus as well as around the cervix. In short, there is increased fetal cortisol, decrease the oxytocinase enzyme, and increase the receptor of oxytocin, increase oxytocin itself, and there are some neurological factors. So these are the components with different theories regarding the uterine contraction. Okay, so here you can see the hypothalamus, which is releasing the cortisol. Okay, so this cortisol impacting the prostaglandin, so which increase the contraction. Okay, this is from the fetal side, and from the placental side, there is a decrease in oxytocinase, which increase the prostaglandin as well as stimulate the oxytocin. So this is second, and the third thing is what the pituitary receptor are increasing, as well as pituitary the secretion from the mother side is increasing. So this will increase the uterine contractions. So what does mean by regular uterine contraction, normal uterine contraction? So they should be regular and rhythmic, so which are becoming stronger and stronger and pushing the fetus. Okay, and there should be at least one in 5 minutes. Okay, at least one contraction in 5 minutes, and it should be last for 30 to 60 seconds. Otherwise, it's insufficient. Okay, so it should be one in 5 minutes, and it should last for each contraction should last 30 to 60 seconds. Okay, and with the cervical changes, means there should be effacement and the dilation of the cervix. Okay, and causing the low back pain and suprapubic pressure. So this is happening in the normal uterine contraction. Why this criteria is important for the contraction? Because there is some other contraction which are occurring before the labor. So those are known as the Braxton-Hicks contractions. So they are actually prepare the cervix and uterus for the labor. So these are not a true labor, it's a false labor, because there is no cervical changes. So no effacement, no dilation. Okay, no cervical changes, and these are irregular and they are painless. So they are occur usually in the last 4 to 8 weeks. Okay, and every 20 minutes, not in 5 minutes. Okay, so it's occur usually in every 20 minutes. So what is the purpose? Purpose is to prepare the uterus and the cervix for the labor. Okay, so these are the early contractions. So these are not true labor, it's a false labor. Okay, so this was the regular uterine contraction. So let's move forward toward the progressive effacement and dilation of cervix. So what does mean by the effacement? What does mean by dilation? Look at here what is happening to the cervix wall. Okay, so this lower segment especially. So it's becoming thin and thin and thin. So this the lower segment thick, which becoming thin by the start of labor. So this is known as effacement. Okay. So why it's happening? Because if you look at here, the upper segment is retracting and it's become thicker. So this lower segment meet with the upper segment. So upper segment become thicker and lower segment become thinner. Okay. So this thinning is known as the effacement. So okay. So this is progressive effacement. And other thing you can see here is the dilation, mean opening. So there is increase in the opening. So this is a progressive opening, increasing the opening, or you can say we measure in the centimeter or by the finger, one finger, two finger, how much it dilated. So these are the two changes mainly in the cervix. Okay, the effacement and the dilation. Other thing you will observe, the cervix also become soft. Okay, as at the time of labor, so it's become soft. and so its position is interior. Okay, if you cannot see in this view, let's see here. So this is the posterior toward the back, while you can see here this is the interior position. So it's a posterior, it's an interior, so it should be the interior position of the cervix. Okay, so interior, posterior, interior, posterior, interior. Interior is the normal which is required. Okay, so this is the cervix. So and come to the, and you can see here the cervix. So you can see here the effacement, and here you can see the 1 centimeter dilated and effaced, and you are seeing the by the time of end of the first stage of labor, so the cervix should be dilated almost 10 centimeter dilation and fully effaced. Okay, so we measure the effacement in the actually in the percentage, 5% effaced, 50% effaced, or 100% effaced. While the dilation we measure in the centimeter, 1 centimeter, 2 centimeter, 5 centimeter, and 10 centimeter at the first stage. Okay. So if you look at the other part of the definition, that is descent of presenting part of feeder. So let's look at here. So we by looking at the cetacean, we define by the cetacean. So here you can see fetus. Here is the pelvis. Okay, so here is the landmark which is ischial spine. We consider if the fetus reaches here, we call it the engaged. So engaged fetus or not. So if we above it, how much centimeter? 1, 2, 3, 4, 5. We measure in -1, -2, -3, -4, -5. So this is cetacean. Mean if -5 means it's 5 centimeter above the ischial spine. Okay, it is +5 mean 5 centimeter below the ischial spine. So it has been crossed. So by the time, so it's the fetus is -5 to moving toward the +5 side. Okay, so it's engaged. So if it's above, we call it floating, meaning it's not reaches here. So here is engaged. Okay, so and if when it reaches 5, so it's known as a crowning, where it's look like a crown. Okay, so mean the cervix with a crown. So like a head with crown. So it's look like the cervix with crown. So it's a crowning. Okay, so these are the definition points. So normal uterine contraction component in the cervical effacement, thinning of the lower cervix. Okay, 0, 50%, and 100%. And there is blood thin mucus release with the onset of the effacement. Okay, you know better. And here is the different conditions. You can see here is the 0%, here is the 50% effacement, and here is the complete effacement, 100%. Okay. And if you dilation of the internal os recorded in centimeter, 10 centimeter is the normal. Okay, and we can check also by the finger, 1, 2, 3 fingers. Okay, and the consistency of cervix should be soft, not firm, not medium. So it's better. Okay, and so here you can see the opening is going to increase. Here is a 10 centimeter. Okay, and you can also measure by fingers, 1 centimeter, 1 finger, 2 centimeter, 2 finger, 4 centimeters. So number of fingers define how much it's the dilated. Okay, and the position, as I mentioned, it should be the interior, and the fetal descent which is coming down of the fetus through the birth canal. So -5 is the floating, and the 0 is the engaged, and +5 is the chronic. Let's take a look of this graph. On y-axis there is cervical dilation, and on the x-axis the time in labor. Okay, so what is happening? So this is a start of the labor. Okay, where you see the dilation is going to increase. So this is the first latent phase of the first stage. So there are 4 stages of labor. So first stage, second stage, third stage, fourth stage. In the first stage is what is happening. So there is effacement and the dilation. So and the first stage is also divided into 2 phases. Latent phase, which you can see here, where the dilation reaches more than the 3. Okay, so it's a latent phase. After that there is the active phase of the first stage. So this is latent phase, and here is the active phase, where you see from 3 to 10 centimeter. So this is the active phase of the first stage. Okay, so and it's also divided into three segments. First is the acceleration, slow acceleration, and then you see the maximum slope, okay, reaches here, and the last segment is the deceleration, less increase in the dilation. So this is the active phase and this is the latent phase. After that there is the second stage start. Okay, if you look at the compare with the sedation, what is happening to sedation, how the baby is coming down. So -5 to +5. So here you can see as the time the dilation is increasing, so fetus is coming down from this. So you can see here it's now become crown. So there is the descent of the fetus. Okay, so this is on this side the sedation, on this side the cervical dilation with the passage of the time. The Bishop's score, which actually we look for the vaginal delivery or the cesarean section. So all five components which we have discussed: effacement, dilation, consistency, position, and fetal sedation. So these five component, and we number them 0, 1, 2, 3. Okay, so effacement less than 30, 30 to 50, 50 to 80, or more than 80. So these are for the effacement 0, 1, 2, 3, and dilation 0% or the 0 closed. Okay, and 1 to 2, and 3 to 4, and more than 5. So and in the consistency, hard, intermediate, or soft, it's only limited to 2. Okay, and in the position, posterior, mid posterior, or interior. Okay, and the fetal sedation 0 is engaged, and more than 1 means it's a descent. Okay, so -3, -2, -1. So these are the Bishop's score. Okay, so what is important? So if this is total number is the 3 plus 3 plus 3 is 9, and plus 4 is 13. So if it is more than 9, so it's suggestive for the vaginal delivery. Okay, and if it's less than 6, the total score is less than 6, so it's difficult for the vaginal delivery. So you can think of the cesarean section. Okay, and if it's between 6 and 8, you should consider some induction measure which may help you to move toward the vaginal delivery, or you can consider it the cesarean section. So depend upon the condition, we go for the cesarean or the vaginal delivery. Okay, and for the mnemonic, so bishop is itself it's a mnemonic. B represent bishop, I effacement, okay, and S sedation, and the H hard mean consistency, O represent opening mean dilation, and the P position. So 5 component. Okay, so just you can recall it by this mnemonic. Here are some modifier for the Bishop's score. You can add one or the subtract one. Add one if there is a pre-eclampsia, or if for each previous vaginal delivery. So how much the previous delivery has happened, 1, 2, 3. Add one, the 1. Okay, and subtract 1 if there is post-term pregnancy and nulliparity, and if there is premature the rupture of membrane, preterm premature rupture of membrane. Okay, so we subtract 1. So these are some modifier, but you should remember this bishop. Okay, mnemonic. Okay, so this was the definition and the component which we have discussed already. Thank you very much. Allah Hafiz.